The CDC has not made any changes to its guidance surrounding pregnant women getting vaccinated for COVID-19. Currently, the CDC states women are eligible and can receive COVID-19 vaccines, but it's a personal choice. Now, that is a bit of a walk back from CDC Director Dr. Rochelle Walensky's comments Friday when she said the CDC recommended vaccinations for pregnant people.
CDC recommends that pregnant people receive the COVID-19 vaccine. We know that this is a deeply personal decision, and I encourage people to talk to their doctors or primary care providers to determine what is best for them and for their baby.
CBS News reporter Kate Smith has been following this part of the story, and she joins me now from New York City. Hi, Kate. So has anyone reached out to Dr. Walensky to ask her to clarify why she made that statement last week? Did she simply misspeak?
Yes, Tanya. So in an email to CBS News, what we found was that when the director said that she was recommending that pregnant patients take the vaccine, what she meant to say was that pregnant people are eligible to take the vaccine. And they reiterated that this is a decision that should be made on an individual basis for individual patients, and it's one that patients should discuss with their doctor. Now, as we know, Tanya, the COVID-19 virus is particularly dangerous for women who are pregnant. You see higher rates of hospitalization and even higher rates of death. And so that is why the CDC recommends that pregnant people who are considering the vaccine really talk to their physicians and their OBGYNs about the risk reward of taking the vaccine.
And so if the CDC has found no safety concerns surrounding pregnant women getting vaccinated, why is the agency hesitant to actually go the extra mile and say they recommend pregnant women get the shots?
So that's right. The Friday comments came on the heels of a new study from researchers at the CDC that found that there was no evidence to suggest that there should be any obvious safety signals for people who are taking the vaccine who are pregnant. Basically, what that means in layperson's view is that there's no extra safety precautions that pregnant people should be considering when they're looking at the vaccine as opposed to people who aren't pregnant. Now, there's a big caveat there. There's no research about pregnancy outcomes for people who have taken the vaccine in the first trimester. Now, what researchers have said is that previous vaccines tell us that there are probably no issues. However, there's no data there yet that would tell us what it would look like at the end of a pregnancy for people who do receive the vaccine in the first trimester. And when we've asked the CDC why they haven't come so far as to say that they, not a full blanket recommendation for the vaccine, they cite the inavailability of data surrounding that first trimester of pregnancy. But the fact that they are actively looking into this, and again, that study that published last week, over 30,000 self-reported data from people who were pregnant that took the vaccine, and again, peer-reviewed study that found that there was no evidence to suggest any safety signals for pregnant people who are taking the vaccine.
And so do you see any signs that this might cause any hesitation for pregnant women weighing whether or not to get the shot?
Well, that's a really good question. It's probably the most important question about all of this is how will this impact vaccine hesitancy? Now, when I've spoken to OBGYNs today and over the weekend about what this kind of guidance could mean and whether or not it's a recommendation or whether it's a recommendation to talk to a doctor, what they're telling me is that patients have been very eager to talk to their doctors about this, have a conversation about whether the vaccine makes sense for them. And by and large, and I should say the vast majority of OBGYNs have found that the vaccine does make sense for those individuals who are asking about whether or not they should be taking the vaccine who are pregnant. So what I'm kind of hearing is that people who are pregnant aren't necessarily really looking to the CDC for specific guidance, but instead they're relying on personal relationships with their OBGYNs, and that will probably not be changing, and they will be looking to those recommendations about whether or not to take the vaccine.
Kate Smith, thank you so much for sharing your reporting with us. We appreciate it.